Living with TMAU has ruined my life. Everywhere I go, people stare, whisper, avoid me. I try to hide it. I stay home. I stay away from everyone. No matter how hard I scrub, no matter how much I wash, the smell doesn't go away. It's like a part of me I can never escape. I'm living a nightmare. I feel so alone. I feel hopeless.
Stories like these are far too common for those suffering from trimethylaminoria, or TMAU. TMAU is a rare metabolic disorder in which trimethylamine, or TMA, fails to oxidize into trimethylamine N-oxide, or TMAO. This failure in oxidation is caused by an autosomal recessive inheritance in a dysfunctional FMO3 gene. This leads to an excess of TMA in the bloodstream, which is eventually released through sweat, urine, or bodily fluids, as well as the breath. Individuals with TMAU report smelling equivalent to rotting fish or other odorous substances. This leads to patients feeling stigmatized or isolated, perceived as lacking hygiene, no matter how rigorously they maintain it. The odor persists as it's driven by genetic and dietary factors beyond their control.
As someone who's suffering, what am I doing wrong to make them ignore me?
Last year's FSU iGEM team also worked with patients who had trimethylaminoria. Their project was called EsperSense.
Our project is called EsperSense, Innovating Hope, a novel solution for trimethylaminoria.
The 2023 FSU iGEM team's goals were to create a cell-based therapeutic that targeted TMAU at the source.
This year's team was inspired by last year's Human Practices work, and reflecting on their work, we felt as a team that there was a lot left unfinished and that there were more areas of the TMAU patients' lives that we could provide hope to.
Currently, there is only one location that offers non-genetic diagnostic testing for TMAU in the United States. This testing, however, is nearly $600, deterring many from seeking a formal diagnosis. Even for those who can afford it, many view it as pointless, as there is no cure for their disease. This profound lack of options drove us to develop a monitoring device. After conducting numerous interviews with TMAU patients, a common need seemed to emerge. That was a need for autonomy. Given this patient feedback, we strived to begin the workings of creating a device that would give them the autonomy they needed. We considered numerous methods of monitoring, but we eventually ended up on a breathalyzer design. Staying in constant communication with patients, there was unanimous support for a breathalyzer design. A common need that patients expressed was a need for discreetness and portability of a device. With these ideas in mind, EsperSense, a breath of hope, was beginning to take shape. To measure TMA concentration, we considered 3 different methods of detection. We considered SPR binding, organometallic dyes, and a biological field effect transistor. Ultimately, we decided on using a biological field effect transistor, or BioFET, due to its ability to have high selectivity and sensitivity. For the BioFET to function, there needs to be a receptor that can interact with the analyte of interest. For our design, we considered 3 different receptors: TAR5, trimethylamine monooxygenase, and trimethylysine. We chose trimethylamine monooxygenase due to its ability to catalyze a redox reaction with TMA. To identify the optimal TMM for our BioFET breathalyzer, we used molecular docking models to study the interaction between TMM and TMA. The software UCSF Chimera helped us visualize how TMA binds to different TMMs, providing insight into binding affinities that were not available in existing literature. We selected TMMs from am-aminosulfadivarins and Rosavarius species 217, designing 5 biological devices. 4 of these, featuring different TMM sequences, were synthesized by IDT and inserted into plasmids. We attempted in vitro protein synthesis using NEB-Express and PureExpress kits, but analysis via simulated gels and electropherograms showed no successful expression. Using PureExpress, our synthesis efforts are ongoing with our 5th device, containing Rosavarius species 217 TMM in linear DNA form, following prior success from the 2019 FSU iGEM team. Purifications were performed using NEB's nickel affinity chromatography, with plans to present our progress at the 2024 iGEM Jamboree. As we have not yet synthesized our TMMs, to establish a positive control for TMA sensing, we purchased off-the-shelf flavin-containing monooxygenase 3, or FMO3, which oxidizes TMA. Upon receiving the enzyme with our connection to FSU's chemistry department, we plan to immobilize it via entrapment on a carbon electrode and perform cyclic voltammetry and steady-state amperometry to assess TMA sensing. To make predictions on our TMM's performance, we modeled steady-state amperometry and plan on comparing to the positive control. In parallel, we modeled the design of our breathalyzer device, incorporating a BioFET sensor with the chosen receptor. This model includes all the necessary components to function: a battery, red, yellow, and green LEDs for immediate patient feedback, a microcontroller, duckbill valve, flow rate sensor, and a Bluetooth module. We created 3D CAD models for the device's circuitry and shell to visualize its design and functionality. The device's functional, streamlined design was directly influenced by patient feedback, expressing the need for a device that was discreet and portable.
One of the key aspects of EsperSense is its complementary use with FSU iGEM's 2023 cell-based therapeutic EsperSense. It will measure the TMA concentration in a patient, and then, through the mobile app, give an analysis and recommendations for the amount of the therapeutic to be taken and when. These 2 business segments together form the parent company, EsperSense Healthcare. EsperSense Healthcare is a pioneering synthetic biology startup focused on creating innovative solutions for patients with TMAU.
The global market for TMAU consists of an estimated 800,000 patients, representing a niche but significant demand for effective monitoring and treatment solutions.
Countless patients have reached out to us and shared their stories and the severity of their symptoms. Many have said that it would be a tragedy if we couldn't get these products to market.
We plan to sell EsperSense directly to consumers through a subscription-based model for the accompanying mobile app.
Due to the chronic nature of TMAU and the persistent demand for symptom management and monitoring, EsperSense Healthcare is positioned as a viable venture. However, our primary mission is to enhance the quality of life for TMAU patients, so we will strive to make our products as affordable and accessible as possible.
Our pricing strategy aims to make the device accessible while maintaining a profit margin. EsperSense will be charged at around $300 for the device, with a monthly subscription fee of $20 for the app's premium features, including data analytics, personalized reports, and telehealth connections to healthcare providers. Our financial projections estimate that within the first 3 years, we will capture 10% of the TMAU patient market, leading to around $24 million in revenue. With strategic partnerships and healthcare provider endorsements, we expect steady, ethical growth for EsperSense Healthcare. Collaboration was something we couldn't do without in this venture. Through collaboration with the Jim Moran College of Entrepreneurship at FSU, our team competed in the Innovation Challenge at the ACC Adventure Prize. We received the Social Venture Award and were awarded $4,000 in funding. By aligning our business with both healthcare needs and market opportunities, we are creating a more hopeful future for patients with TMAU. This year, we felt a responsibility to educate the public about trimethylaminuria, or TMAU, while also continuing the tradition of community engagement started by last year's FSU iGEM team. One of our main efforts was organizing the second annual Tallahassee Biotechnology Expo, bringing together K-12 students and the local community through hands-on activities and discussions held in collaboration with the Challenger Learning Center. We even had access to the Challenger Learning Center's IMAX Theater, where we hosted a presentation on both past and current FSU iGEM projects. This year's expo was a huge success, with over 200 participants, double last year's turnout, and a highly positive response from the community. We're proud to have expanded this event with the support of local universities and institutions, and we're excited about how it continues to inspire curiosity and interest in how synthetic biology can solve problems. For the bronze medal requirement, our team documented the characterization of BBA K4680004 on the part registry page. We also shared SBOL on BioRender with 120 iGEM teams across the world, providing a detailed tutorial. For the silver medal requirement, our team performed the design, build, and test cycle of BBA K5064001, as well as our commitment to human practices. For the gold medal requirements, our team performed integrated human practices, entrepreneurship, and modeling. With EsperSense, we're offering TMAU patients more than just a device. We're offering hope for a better future. Our work combines innovation, education, and compassion to meet a real need in the world. While the journey continues, we're proud of what we've achieved so far. Together. Each step brings us closer to a future where TMAU patients have a breath of hope.